All right, so here we are again, same book. Now we are looking at the supraspinatus muscle and how it fits deep in the groove above the spine of the shoulder blade. And it attaches to the top of the humerus, and its primary job is just to lift / abduct the humerus, right, to the side. And as we've been looking at the deltoid and the trap and the pec minor, if we've got anything funny with those muscles, then the supraspinatus is going to have trouble lifting the arm, right? And that is not uncommon at all. If the pec minor is pulling the coracoid process forward, then the supraspinatus has to do something funny to lift the arm. Can you imagine that, right? So we have to make sure that our pec minor is not pulling the shoulder blade forward so the supraspinatus can just do a nice simple movement. And the supraspinatus actually goes under the acromion process so that when it lifts the arm, it should actually start abduction of the arm bone before it starts on any level hitting the acromion process right there. So that's a movement that very, very commonly is not occurring, that the humerus is rotating in the socket below the acromion process before it starts to actually hit the attachment of the shoulder blade itself, right, from that acromion process, which is one of those pieces that comes off the shoulder blade. All right, so spend a little time just understanding that one muscle and imagining how many things could potentially thwart its ability to do its job, such that it ends up aggravating the shoulder joint a little bit. You can get like the bursitis under the acromion process there. So very, very often, the way the trap's attached to the collarbones, the way the deltoids are attaching to the arm, the way the shoulder blade is being held on the spine, the pec minor is not pulling everything this way, right? And so these are the things that make the shoulder girdle seem very complicated and have so many choices. But if we can watch it branch out from the center and have the smallest little muscles like the pec minor and the rotator cuff do their best job first, then bigger muscles like the deltoid can come in and help move larger movements. But we'll know that everything actually was in the right place first. Okay, so we'll look at the infraspinatus next.